Hello, I'm Dr. Suraj Chiraniya, hematologist, hemato-oncologist, and bone marrow transplant physician in Mumbai. Today, one young patient, 22-year-old, came walking in the OPD considering himself a case of anemia because he has done a CBC that shows a low hemoglobin. When asked further, he had a history of fever on and off, weakness, extreme tiredness, and sometimes bleeding spots on the lower limbs, or sometimes occasionally in the glum blade. When we seen the CBC report, it shows low hemoglobin, low WBC, and as well as low platelets. So it was not a case of only low hemoglobin, it was a case of pancytopenia, means all the cell components were decreased. So we advised to do a bone marrow test that showed and confirm the all cells are not produced in the bone marrow, leading to this defect. So friends, we will try to understand what is this condition called as aplastic anemia. Usually there are three blood components in our body. First is red blood cells, we called it as hemoglobin. Second, white blood cells. Third is platelets. Every cell has a different function. Red blood cells or hemoglobin carries oxygen from lungs to various parts of our body. Second, WBC, these are produces important cells to fight against the infections. Third, platelet, these are cells that helps to clot the blood. Deficiency of each component causes a respective symptoms. So in aplastic anemia, all three cell lines are decreased because they are not produced in the bone marrow because of the damage to the stem cells. So what causes aplastic anemia? Most of the times the cause is idiopathic, means not known. There are various factors may contribute it. First is autoimmune problem. There can be some autoimmune stimulus leading to destruction of the stem cells by their own immunity. Second, it can be related to viruses like non-A, non-B hepatitis, CMV, EBV like viruses. Third, exposure to the chemical agents. Fourth, exposure to the radiation. These are the most common causes, but sometimes and most of the cases, the cause is not known. How we diagnose it? Whenever any patients come, as I described you, decrease on hemoglobin, WBC, platelets, so usually we suspect a pancytopenia. And when there are no lymph nodes and splenomegaly and hepatomegaly present, so this points towards the aplastic anemia. It has to be confirmed by doing a test called as bone marrow test. Bone marrow test we do in local anesthesia. We draw blood from the hip bone after giving the local anesthesia. After removing blood, we take a core biopsy of the bone and check under the microscope. So in this, there are all decrease in the lineages leading to the aplastic anemia. Third, in the young patient, we do certain karyotyping and molecular tests to know is there any genetic defect that leads to the aplastic anemia. Because there are some conditions like Fanconi anemia, dyskeratosis congenita, or other genetic defects that can cause aplastic anemia like features. Coming to a treatment options is vary depending on what causes. Most of the times it's a immune mediated process, so immunosuppressive agent can be helpful. So if we see young patient like this, less than 40 years old, and he has a mass sibling donor present, that time stem cell transplant is a standard of care in such patients. Second, when there is no stem cell donor and it seems to be a immune mediated, then anti-thymocyte globulin plus cyclosporin plus eltrombopag can be a treatment of choice. If they don't respond, then we can search for the alternative donors. Third is supportive care. Supportive care means giving the regular blood and platelet, and we can add medicine such as cyclosporin, eltrombopag, danazol, or other hematopoietic stimulating agents like GCSF, erythropoietin to it, but these are effective only in 10 to 20% of the cases. Coming to our first patient that we were discussing, so Though aplastic anemia includes anemia as a surname, but it has effect on all the three lineages. So along with hemoglobin, WBC and platelets are effective. This is a very rare and serious condition. Whenever you have such findings in your CBC report or any person having such diagnosis, please refer to a hematologist who is trained in doing stem cell transplant, so he can give the treatment option right from the basic treatment to advanced treatment like transplant. Till next video, stay tuned, stay informed. Thank you.